If you're experiencing depression or changes in your mood, or you've seen it in a loved one as the weather changes, you're not alone. We're going to explain the symptoms and treatment of seasonal depression. With more on this now, Dr. Chad Domingue, a neurologist and pain management expert with the Avila Physician Network, to answer some of those questions. Thanks for joining us.
Yeah, great to see you guys. These dark days are beating us all up, absolutely.
Yeah, especially when the sun is just not around, that makes it worse. So what are the symptoms of seasonal depression? Who does it impact the most?
Yeah, so 5% of all Americans have seasonal depression. About 10% get milder symptoms, and 5% get really depressed. Obviously, see a little bit more in northern, colder climates, Seattle, where they have that dark weather all the time. People that have an underlying psychiatric problem are a little bit higher risk. But depression is just that, right? Feeling guilty, not sleeping well, my mood's down, all these things. And then on top of that, Liz, when you add these dark days, it's cold, we're not as active, we're not doing as much as we want. So it's a combination of this stuff. From a neurochemical standpoint, it's not just dark days, it actually affects our brain. So I have my brain here. So as the light enters our optic nerve, it enters the interportion of our brain called the hypothalamus. And so we have this internal clock in our brain called the suprachiasmatic nucleus. This guy communicates to the raphe nucleus, which secretes serotonin. It talks to the pineal gland, which secretes melatonin. So you can see how all these things can interact. So that sunlight is actually working to change the chemistry in our brain. And here's the thing that's interesting. I didn't know this, and I learned it during the research. Our vitamin D levels will also decrease because less sunlight. And we always think of vitamin D in regards to pain and bone, but vitamin D and serotonin are intertwined. So it's a double whammy. So the sunlight's decreasing vitamin D, serotonin, and we become depressed.
So what are the treatments? Because some people only say it's not that serious. I mean, just work through it. But are there treatments for people who significantly are impacted?
Yeah, as we always discuss, start with seeing your doctor, because first things first, is it seasonal depression or something else? Is it a thyroid problem? Did you take a new medication? Do you have another underlying disease process that's manifesting itself as depression? So that's where you want to start. Then you get into prescription medications, which obviously I think for this is not the answer. Where I want to see is you want to treat the disease. And what's the disease? You're not getting enough sunlight. So you want to be active, aerobic exercise. You want to be outside, maximize sunlight. You can actually do light therapy. There's some special fluorescent lights that are 20 times stronger than a normal light that you use about 15, 20 minutes in the morning to kind of get that part of your brain circulating. Yoga, meditation, Pilates. A lot of people kind of say, oh, hum to this stuff, but there's medical literature to show that it changes your chemistry and allows you to deal with these reactions. There's several supplements. Obviously, vitamin D supplementation is important. 5,000 international units a day. Passion flower is a good one. 500 milligrams twice a day. Low side effects. Magnesium taurate is a nice one. 400 milligrams. And then if you have a problem sleeping, I always recommend valerian root to my patients. About 500,000 milligrams. It's a really nice medicine to help you sleep, control anxiety.
Okay, but the bottom line, you always stress, check with your doctor first and don't just ignore it thinking or just get over it, right?
Yeah, just don't blow it off. I mean, again, in a COVID world where we're more in tune to our symptoms, I mean, there's a lot of things that could be causing this. And just don't think that, oh, well, everybody's having it, it's no big deal. I mean, you need to take it serious. See your doctor.
Thank you so much, Dr. Chad. Some good tips dealing with seasonal depression. Appreciate it.
Yeah, good to see you guys. Have a good holiday. Take care.